Hi, I'm Edie Hapner, and we're going to continue talking about my favorite research topic, the aging voice. But now we're going to talk about evidence-based therapy for the aging voice. First and foremost, let's make sure that we're all talking about the same thing when we use the words evidence-based practice, evidence-based medicine, or in my case, evidence-based therapy. What is evidence-based practice? It is a melding of the best available evidence, the clinician's expertise and know-how, and a sprinkling over both of those of the patient's values, their preferences, and their needs. That's what we're going to talk about today. What do we already know? What did I already teach you in the last session? Age-related changes to the voice are real. Changes to the vocal mechanism occur around menopause is when they start in women and a little bit older in men. They are often problematic for everyone by about 65 years old. They accelerate like changes to the body accelerate at 75 years old. They impact the quality of life of our older adults, and they are reported to occur at a very high rate. 20% of people over age 65 report that their voice is a problem, and 80% of those, you may remember, report it impacts the quality of their life. Can we treat these changes? Can we as speech pathologists do anything about that? Well, we know from the exercise literature, from the health literature, from the physical therapy literature, that we can treat aging muscles in the rest of the body. And let's not forget that the larynx is made up of a lot of skeletal muscle that's fueled in a very similar way to our arms and our legs. And we have synovial joints in our larynx, just like our elbows and our knees that get arthritis and are a little less flexible. And as a matter of fact, our vocal folds get stiff too, kind of like the rest of our body, but it's more the tissue. So what has aging and exercise taught the speech pathologist? Aging alone is not a reason for functional decline, and that the loss of physical independence or voice before age 75 years old is as a result of disease, genetics, or a just plain destructive lifestyle that happens in the voice for sure. What have we learned from our senior Olympians? There's little decline in running times up to the age of 49 years. That's amazing, isn't it? You can stay about the same if you exercise to the same level to about 49 years old. And somewhere between 50 and 75, there's only about a 3% decline in running times for males and females. Now, after about age 75, there's a sharp differential between what happens to women and what happens to men, with a 10% decline in running times in women and a 4% decline in running times for men. We aren't sure if it happens exactly the same way in the larynx, but it certainly is a lesson for us to learn. And we take our lessons from senior Olympians and actually are vocal athletes. And who are our vocal athletes? We think they're our singers. And what have we learned from them? In good research that's been done, singers who are over the age of 65 are perceived younger than their age-matched counterparts, and they also have less roughness, less hoarseness, and louder voices than their age-matched counterparts. And the only thing we know that was different was that they sang. So let's think a little bit about treatment. You know, I told you before that what happens in the larynx is that the vocal folds start to atrophy, the loss of lean muscle mass. And that results in a glottal gap where the vocal folds not coming together completely. So in the body, what we do to work on atrophy is resistance training, strength training. You all know that from going to the gym, right? And what is strength training? Well, strength training is a method to induce muscle contractions that result in anaerobic exercise or anaerobic metabolism and hypertrophy of the muscle, or the muscle itself gets bigger, as you can see in this bottom diagram of the two biceps. We wonder if glottal closure exercises are ways to induce muscle contraction and potentially hypertrophy to close the glottal gap. Let's take a look at some aging vocal folds so you understand what that glottal gap is. Oops, let's go back. Okay. There we go. There's a lot of squeeze going on to get those vocal folds together. You might even recognize that voice. It's the voice of the man you heard before. But you can see that the vocal folds don't come together.
Okay, and just comfortable.
And I already gave it away a little bit, but do I think that vocal fold exercises can impact the size of the vocal folds? Yes, I do. I also told you that there was a loss of flexibility in the body and a loss of flexibility in the vocal folds. Well, flexibility in the body is all about range of motion. Flexibility in the vocal folds is all about the physiological pitch range of the person, and the way that happens is by stretching the vocal folds. Let's try this one again. Let's take a look.
We go out,
I just want you to watch. That's just some plain old atrophied vocal folds trying to come together. But then they're going to try and do a range for us. Look, high pitch, what happens?
Breathe.
The vocal folds stretch. Those are atrophied vocal folds. But they can still stretch and get a higher pitch. So do I think that stretching exercises might be part of the treatment in voice therapy for aging voice? Surprise. Yes, I do. Now, here's something to think about. Can we increase respiratory support? Remember I told you there's a loss of available oxygen, both for voice and for the rest of the body. These are interesting pictures. The lungs on the left are actually the lungs of an 85-year-old, and the lungs on the right are the lungs of a 25-year-old. And there's something that happens in aging called senile emphysema. It happens in non-smokers, so no judging here. It's not emphysema like you think, but it just means that air gets trapped in the lungs, it cannot be expelled, and it's not usable air. Thus, they have less air to fuel their body and to fuel their voice. The blue is trapped air. So you can see that there's a lot of trapped air in the 85-year-old lungs. There's no trapped air. There's no emphysema in the 25-year-old lungs. From what I know about respiratory physiology, do I think that we can actually increase respiratory drive in the aging? I don't. Lastly, if we think about learning a motor activity, the way we learn motor activities is through practice, practice, practice. It's actually motor learning. And what happens is your brain eventually takes over the task in something called the habit loop, so you're able to do motor tasks without thinking about it. Like when I pull out of the garage and press the button to close the garage door every morning and get halfway up the street and say, did I close the garage? It's the habit loop, because through motor learning, I have learned that activity. Well, voice therapy is best accomplished through motor learning. And what does motor learning tell us? When we first learn a new task, it's introductory. We have to think about everything that we're doing, whether it's riding a bike or using your voice. As we practice that actual task, and we get to the advanced stage, there's less brain in the task and more just habit, just neurologically doing or changing how the voice is used. And finally, when we become expert, there's very little brain in the task. Our brain knows how to do something, says, you got this, and doesn't waste its energy on helping you every time you want to ride a bike or voice in a new, shall I say, louder way. So do I think motor learning is the way to treat voice disorders? Whether you're old or not, the answer is yes. So what do we know about voice disorders and in the aging and voice therapy? There's been some nice research done. Vocal function exercise developed by Dr. Stempel and his colleagues in 1994 have been examined about 3 times in aging population. And all 3 times, the authors of those articles and of that research found that vocal function exercises actually improve the voice of people who have age-related dysphonia. Karen Easterling was doing a very interesting study on aging swallowing and found out, coincidentally, when she did the Masaka maneuver, that her patients actually reported improved voice, not just improved swallowing. And that's more of a Valsalva maneuver. Think about that. And the last one, Forte, phonation, it's actually resistance, but for today we're going to say respiratory training exercises. I had the pleasure of being involved in the research and development of with my colleague Erin Ziegler and several others. And Forte is built on the premise that when you use a megaphone mouth posture, you ready? Right? Small in the back, big in the front. That what you do is bring the formats together, 1 and 2, and that actually causes the glottis, or is a result of the glottis coming together, the vocal folds coming together a little bit more tightly, and potentially a glottal closure exercise that might potentially be a resistance exercise if paired with having to resist air. So let's look at Forte in this cute little patient. I'm not going to bore you with every single step, but she's going to go through steps 1, 2, 3, and 4. There's only 4 steps. It's very simple. It's built on the concept of bringing the formats together, bringing the glottis together, and it's also built on keep it simple and practice it a lot, motor learning. So here we go. Here's step 1. Voice of authority, low and loud, like this. Good morning. Nice and loud. Go ahead.
Good morning.
Nice and loud.
How are you feeling? Have you had breakfast
I want
yet?
to get the point across.
When are you
in
going
this
to the Y?
80-plus-year-old lady,
Teresa's coming
but
for
she's doing a
lunch.
pretty good job here because I'm
Cards.
tired already.
How was your baseball
Okay,
game?
let's stop that and look. Okay, glottal resistance, glottal closure, megaphone mouth posture. Exercise 2. Repeat, deep breath, hold on as long and loud as you can. Go. Keep it up, don't lose it. Could that be flexibility? And exercise 3 and 4, I'll let you listen a little bit. Like this, low to high and then all the way down. Don't stop. All the way down. You ready? Go. Loud. Voice of authority, the low end of her range, loud, in sentences that she uses
Good. Do it again.
every day, hence motor learning. Exercise 4. Same sentences, high and loud, lots of practice, motor learning. So Forte is built on the premise, on the hypothesis, that it improves speech breathing, not respiratory support, but speech breathing through increased respiratory and phonatory coordinated muscle activity. It's also built on the premise that it improves phonatory glottal closure through increased intrinsic laryngeal muscle exercise or activity and increased subglottal postures. And its goals are to raise vocal intensity, to improve vocal quality, to increase vocal endurance, and to decrease vocal effort. The one thing that our lovely, lovely elderly patients complain about is, I'm retired, I want to play cards, I want to give speeches, and I don't have the vocal intensity and I don't have the vocal endurance. Why? They want to play with their friends. And guess what's happening to their friends? Presbycusis. So here's a little bit of evidence. We did a randomized controlled trial. We're looking at vocal function exercises, Forte, and no therapy. And we did a standard amount of time for all 3 groups, and the same amount of practice for vocal function and for Forte. And what did we find out? Well, when you do voice therapy, you get better. So both the vocal function exercises and the Forte groups got better. Less vocal effort, louder voices, happier lives, better voice quality of life. The group that didn't do any therapy stayed the same or actually declined a little bit in a 4-week period. But what do we also find out? Our subjects, our participants, liked Forte better. And what does that mean? When you like something more, you're more apt to practice it. And I know this might seem, like, of course, but this seems to be a novel concept to some of our patients. Voice therapy works when you practice what you've learned. So we want to get them to practice. And they also report that it decreases their vocal effort so that they aren't so tired and they want to talk. So we know that aging is inevitable, but decline is optional. And I'd like you to hear what one of my patients said recently about practicing his voice exercises because they're loud.
I will do it every day, even if it have to run my wife out of the house.
There you go.
Oops. Are there any questions? Yes.
How is this, is insurance paying for it, I guess, is what I'm trying to ask the question about, is how is insurance paying for it, and how is it coded?
For voice therapy?
Voice therapy.
Well, so insurance, most of our patients are covered at this age, are covered by Medicare, although I have done what we call voice building, both vocal function exercises and Forte with people between 60 and 65. But Medicare does pay for voice therapy. When we have ICD-10, maybe in next year, maybe, there will be a code for atrophy. Right now, there is not a code for atrophy, so it's coded generally as dysphonia, and it's still getting paid. But here's the nice thing about both vocal function exercises and Forte, and that is that there's not a lot of therapy. So people who come to see me for Forte have an initial evaluation, which is, really what can they do? What are their extremes that they can do? And then it's all based on working at 60% of their highest level and building every week like you would in an exercise program for your body. It's based on exercise science principles. So they come once. If I'm not sure about how they're doing, I might have them come back in 2 weeks. They definitely come back at 1 month and 4 months. So how many times did I say? 4. They go home with a training DVD where they can practice with me and some written information. Sometimes we even do a little telehealth, although Medicare won't cover it, so they don't get charged for it, so that they don't have to make the drive back into the city. Short therapy, I think it's the wave of the future. Yes?
I was just kind of relating this to music. They've always taught us a lot of breathing exercises to try to increase intensity and increase the productivity of the air that you're bringing into your lungs. You were talking about for forte, you have intensity increases and that would help. So do you use and like teach them breathing exercises as well to the voice therapy?
Well, you know, it's an interesting question. I actually am happy you asked that. There's been controversy in voice about the place for breathing exercises forever. And does everybody have to have low abdominal breathing? Because a lot of singers, the problem is, depending on how you sing, whether it's German, right, big chested, or bel canto with a low abdominal breath, you have to work more on breathing. What we know is that good breath gets good voice. And so we don't spend a lot of time working on breathing, but in that very first session, I try to teach them to avoid things like this. Ah! Sorry. And to do a low abdominal breath and a little bit more of a forward focus to the exercise. Mm-hmm.
I know that you said that decline is optional. I was just wondering if there's anything we can be doing now to like help improve our voices for the future.
Sing, apparently, right? Sing, sing, sing. So the one thing that we know is that singers' voices stay younger longer. And so I'm voting that we all start singing. Shower. You know, I don't believe you have to be a trained singer to sing.
Okay, that's what I was going to ask you. I sang in high school, and I've always been taught that there was like a right way to sing and a wrong way to sing that can like hurt your voice. So I was also wondering if that was.
There is. That's a huge topic, yeah. Phonotrauma. There is a right way and a wrong way to sing, but I don't think it's as black and white as some singing teachers may want us to believe, because I have lots of patients who are headbangers in their singing, but the rest of their lives they're very soft-spoken. And they don't have voice problems. I have some other people who, some famous people that get on the stage and have lots of people taking care of them and should prevent them from being vocal overdoers with interviews and TV shows and never being quiet, and they end up with voice problems. So I think it's a little bit more about your vocal load and singing and then taking care of your voice when you're not singing. Singing's a lot harder on your voice than speaking. So, yep. Yes, sir.
We've been talking a lot about singing, but do you think that learning a wind instrument could potentially be like a good solution for people at older ages?
Fantastic. So, you want, I had a gentleman last week, I promise, last week, who came in to learn forte. And I said, well, let's see, you know, in our evaluation, what is the maximum amount of time that you can hold a sound loud? Because remember, I want to find out their max, just like in the gym. How much weight can you lift, you know, 1 time or 10 times, and work at 60%. And that man held ah for 52 seconds. Okay, I was out by 10, 12, right, honestly? And I was staring at him like that, and I said, do you swim? Do you run? And he said, yeah, I play sax. Yes, because there's valving at the vocal folds when you play a lot of winds, and at your lips, both, I know, and you have to learn to manage your air. So I think when you're playing a wind instrument, you're doing a lot of resistance exercise all the time. Yeah. Great questions.
I was just curious about the availability of forte and also how you would implement it in another setting, for example, at a skilled nursing facility or something other than a clinic.
So you need nothing magic for forte, except I like to all of my patients have iPhones and iPads or Androids or something like that. So I like to download free apps that show how loud someone is, just because it helps them practice at their extremes when you're not around. But we published Forte in a manual by Allison Bierman and John Haskell last year, step by step. There's nothing proprietary. You don't have to be certified. It's for everybody to use. So we published it there. We've also published it in Laryngoscope, which is a peer-reviewed journal. Is where we published our randomized controlled trial. But you can easily get it from Allison Bierman's, or we present on it. Both Erin Ziegler, Dr. Ziegler, and I present on it a lot. So happy to teach anybody.
I have another one.
Sure.
Talking about exercise principles.
Yes.
One of our professors this past semester talked a lot about the amount of time it takes before you have central changes and then the peripheral changes. And the study that you talked about showed results for voice therapy pretty quick, in 4 weeks. So exercise principle, at least for me, I know when I go to the gym and I start lifting, my biceps not going to get a whole lot bigger. And
That's hypertrophy, not neurological change, right?
Right.
Yeah.
So I was just curious what after you dismiss a patient from service and you're wanting them to maintain the gains or at least continue with those, what kind of follow-up is there after?
Right. So, I have a degree in exercise science, so that explains why some of it is built on the principles of exercise science. So the brain takes about 2 weeks to make changes, when you're learning something new, when you're learning a motor act, it takes a couple of weeks. I tell my patients who do LSVT for Parkinson's disease, and I tell my patients who do Forte that in general, after 2 weeks of everyday practice, your friends, maybe not you, but you'll start to hear from your friends things like, I think you sound a little better, all right? But don't expect it right away. Just like a diet, just like going to the gym. It's really frustrating because I go to the gym one day and I want to look better the next, and that's not reality. But I believe that we start to really hear changes at about the 4-week mark. How does that relate to hypertrophy of the muscles? It's much faster. But think about the vocal folds. The vocal folds mine vibrate on average 212 times a second. That's a lot of contractions in a short period of time. So even holding that ah for 52 seconds at 100 cycles per second, he did a whole lot of work on that. All right, so I think the voice responds quicker. Can I say that we hypertrophy the vocal folds? I cannot. No one can. We don't have the ability to measure those changes yet. Can I say that I think that one of the things that happens is that the brain and the larynx, the breathing and the larynx get in better sync? Yes, I think that's what really happens. And then as people continue to do it, then maybe some building happens. So what happens? I like to see people at the 2-month mark and at the 3-month mark. And then I say to them, so after 1 month, I should take a step back. After 1 month, the first month they're practicing twice a day. The second month I say, let's practice once a day and see if you can maintain. But if you notice in a week or so you're not maintaining, go back to twice a day for the rest of this month, come back in at the end of the month and we'll try it again. Everybody's body's a little different. We all know that. But what we try and do is get them down to about twice or 3 times a week, once a day practice. And I say, you probably are going to have to do this forever. Because what happens in aging, you are fighting a decline every single day. It's not young and healthy. Things are changing every day, so I think they probably have to do it forever. No one's complained yet. Yes, ma'am.
I was wondering, I know we kept talking about the age of 65 as being the primary age that all this happens, but is there anything that would cause one's voice to decline before that age?
Oh, hundreds of things. So, the problem with voice, here's the problem. there's only a couple of symptoms. We use the word hoarseness, or we don't, the lay public does. That doesn't really mean anything to us, so we don't use it. But the voice can get rough and unstable. You can lose your range. It can get breathy. And there's lots and lots of reasons that can cause it, from bad muscle behavior to a lesion on the vocal cords to neurological damage and all the way to cancer. And that's kind of the bad thing about cancer in the larynx. It doesn't hurt. So voice problems, people come in all the time and go, my voice, it sounds terrible, but it doesn't hurt. And they always seem a bit surprised when I say, I'm not surprised, I don't expect it to hurt. So lots of things. The rule of thumb is if your voice has changed and you can't relate it to screaming at a football game, that would never happen here, right? Or a really bad cold, you know, it's been a long time since those happened, and it's about 3 weeks continuous voice change that you should go see an ear, nose, and throat doctor to have them look at your larynx. Your internist can't see your larynx with a mirror, with the tongue blade in the back. You can only see it with laryngeal imaging or with a mirror. 3 weeks. And if you smoke, go in 2 weeks. Okay? Anyone else? Well, thank you very much. You guys are great.